everyone. Thank you, Gail, for that introduction. And yes, Gail and I have known each other for many years. And similar to Amelia, I saw her present, I think it was probably in 2005 at VCU, and it changed the entire trajectory of my career. And I consider her one of my longest and best serving mentors that has helped me both personally and professionally. So thank you, Gail, for that mentorship. It means a lot to me. And as she said, my name is Jennifer Johnson, and I'm a professor and chair of the Department of Sociology at Virginia Tech in the beautiful Blue Ridge Mountains. And I'm here today to present a model for understanding the role of digital pornography in the sexual abuse of children. This research was conducted by an interdisciplinary team that has been working together for over a decade, examining digital pornography and its implications on sexual health and interpersonal relationships. While our previous research primarily focused on college students and young adults, we have now turned our attention to pornography's impact on children, due in part to two concurrent trends in the data. Data show that 1 in 8 children worldwide faces sexual abuse before adulthood, with an average victimization age of 14. We're witnessing a shift as children increasingly become perpetrators of sexual abuse against other children. Concurrently, over 90% of boys and 60% of girls will have encountered pornographic explicit content during their adolescence, with the average age of first exposure around the age of 11, most often through a digital device in the home. Yet there's little research exploring the connection between these two patterns in children's lives. Most research focuses on adult perpetrators and their pornography consumption. However, research on pornography itself indicates that there may be a more complex relationship between pornography and child sexual abuse. Research on pornography itself indicates that it plays a significant role in the lives of children and adolescents. Not only are most children exposed to pornography by the time they are teenagers, they report pornography to be their primary source of sexual education. Exposure to the pornographic sexual script generally occurs prior to their first sexual encounter, thus laying the foundation for what is expected of them and of others during sex. Research on the content of pornography reveals that depictions of sexualized signifiers of childhood, such as a lack of pubic hair or childlike clothing and language, is common. Research also indicates that the line between consent and abuse is obfuscated by these images, and that pornographic behaviors that eroticize youth is normalized in pornography. Additionally, the legal system lags behind the rapidly advancing digital world and struggles to legally differentiate between normal sexual exploration and sexual abuse, particularly as it relates to consensual exchange of images between adolescents of a similar age. These patterns have grown more evident and pervasive through the internet and the digitization of pornography. Our previous research on college students and young adults indicate that higher rates of pornography consumption are associated with lower rates of sexual intimacy and lower rates of sexual satisfaction, as well as greater rates of objectification of others and greater likelihood to engage in the sexual acts depicted in the pornographic script. Additionally, a 2016 meta-analysis conducted by others indicate that higher rates of pornography consumption is associated with higher rates of sexual assault among adults. If pornography consumption has been shown to play a role in the sexual behavior and choices of adults, asking questions about its impact on children is even more critical, given the ever-increasing access they have to a panoply of problematic pornographic imagery. So specifically, our research question is, what role, if any, does pornography play in the sexual abuse of children? Anecdotal evidence suggests a complex relationship between pornography and child sexual abuse, but there is little empirical data to substantiate these observations. In response to this gap in the literature, Culture Reframed commissioned and funded this study with the goal of collecting empirical data to begin to systematically answer this question. Through snowball sampling, we interviewed 50 frontline workers who have been working directly with children for at least 5 years who have been sexually abused. Participants span multiple countries and included professions such as forensic interviewers, therapists, counselors for children with problematic sexual behaviors, doctors, pediatricians, sexual assault nurse examiners, law enforcement, and others involved in the criminal justice system. Several participants had worked with abused children for over 20 years. Participants were asked about their experiences working with children who have been sexually abused and whether or not they had seen any connections between pornography and sexual abuse. Interviews lasted anywhere from 1 to 3 hours for a total of 76 hours of interview data. Through 240 hours of coding and analysis, we built a model that captured their accounts of the role that pornography plays in the sexual abuse of children. We then conducted 8 focus groups where we invited participants back to provide any confirmations, corrections, or clarifications on the initial model. The model I am presenting today is the culmination of 2 years of data collection and 100+ hours of research provided by committed frontline professionals who work directly with children who have been sexually abused or reported for perpetrating sexual abuse. And so here is the model. Right? So here is the final model. And this slide presents a high-level overview of the dynamic interplay between child sexual abuse and exposure to digital pornography. Each of these categories will be examined in greater detail over the next few slides. But for now, let me begin with a general description of the model and a few definitions. We anchor the model in the public health concept of health risk. According to the National Institutes of Health, a health risk is the chance or likelihood that something will harm or otherwise affect your health. Risk doesn't mean that something bad will definitely happen. It's just a possibility. It just increases the chances. Risk factors are characteristics at the biological, psychological, family, community, or cultural levels that precede and are associated with a higher likelihood of a negative outcome. Our model seeks to outline factors that put children at risk for potentially encountering digital pornography and how that encounter may also put them at risk for child sexual abuse. It is important to note that the model does not make a causal argument. We are not arguing that digital pornography causes child sexual abuse. Instead, the model points to the various ways in which digital pornography may increase the chances that a child will experience sexual abuse, either as a victim or as an initiator, perpetrator. We use the statistical term mediator to describe the various ways in which pornography can create risk. A mediator is a pathway between 2 variables, in this case, digital pornography and child sexual abuse. It shows how one variable impacts another. Our model also uses the concept of risk to describe the social, cultural, and interpersonal factors that put children at risk of exposure to digital pornography or sexual abuse. Additionally, the model emphasizes the potential for a dynamic relationship between the two, such that child sexual abuse may lead back to digital pornography, either through consumption or the creation and distribution of pornographic material. Again, it should be noted that the cyclical pathways are potential in nature rather than guaranteed to occur. Just because a child experiences sexual assault does not automatically mean pornography will be involved. Our model attempts to capture the potential pathways through which pornography may be involved, including coming after the abuse has occurred. Finally, we use the term interrupters to describe the ways that the cycle of abuse can be broken. Interrupters are defined as actions and efforts taken to disrupt harmful patterns or behaviors and avoid harmful consequences and promote positive outcomes. So with those definitions and high-level overview in mind, let's now look at each component of the model individually. I will move through the model in the direction of digital pornography in order to emphasize the role of the mediators in connecting pornography and child sexual abuse. So the first slide, the first part of the model, outlines the social, cultural, and interpersonal factors that may increase a child's risk of exposure to pornography, as well as the likelihood that they may experience sexual abuse either as a victim or a perpetrator. And remember, this list was derived from the interviews with the 50 frontline professional workers. So this is a data-driven list based on their experiences. As you can see, these risk factors include the quality of a parent-child relationship, generational trauma, technology, poor social support systems, and a culture steeped in violence and gender inequality. As you read the list of factors, I want to highlight two important points. First, unsurprisingly, rapid technological change and unfettered access to the internet play a significant role in creating risk for children, due in part to the lack of technological awareness and savviness among parents. Technology is basically changing faster than parents can keep up with. However, what was also frequently mentioned was the lack of social support parents and families receive to help them manage not only rapid technological change, but also for helping them cope with the impact that these changes have on their relationships and the health of their children. A lack of reliable access to social services, educational resources, and quality health care increase the risk for children. This list of risk factors reveal that parents are not alone in creating and managing risk for their children. Just as it takes a village to nurture and develop children, the village is also implicated in neglecting and harming children. And what we can see is that these risk factors concatenate to create the secondary risk of exposure to modern digital pornography. Modern digital pornography is different than old school pornography. It is copious. It is a copious amount of never-ending novelty, highly interactive, visceral, and delivered through push marketing to people of all ages, including children. It reaches them through websites, text, social media, direct messaging, and video games. It is a commercial product, not a sexual education product. It is a commercial product driven by profit and controlled by bots and algorithms. I cannot emphasize how important that is to children's experiences with pornography, that there is a machine, an industrial machine behind their experiences. It is not about sexual health or sexual inclusiveness. Digital pornography is really a form of technology that drives innovation, amasses terabytes of content, tracks users across digital devices, collects and sells user data, and uses sophisticated methods to secure profits and hook consumers, all of which creates privacy and legal risks for those who encounter it. These business practices of the modern digital pornography industry and the content it produces creates different pathways of risk for children. And based on our data, there are 4 primary pathways through which digital pornography creates risk for child sexual abuse. First, and most basic, is through social modeling and imitation. Like all humans, children mimic what they see around them. And given the new technological reality, digital pornography is readily available. Participants frequently reported that modeling and imitation of pornography was most often observed in child-on-child sexual assault. Either the child reported wanting to try something that they had seen, or they reported that they were being asked by another child to engage in behaviors mimicking something that they were seeing in pornography. The second pathway is normalization. What is seen, repeated in pornography becomes normalized and expected. Research on pornographic content reveals that 80 to 90% of popular pornography contains aggressive acts, most often towards women. Respondents frequently reported that children's accounts of sexual assault would often minimize certain aggressive acts, such as strangulation, reporting those acts as normal and to be expected. Oftentimes, children had a difficult time identifying what behaviors constituted the assault because the boundaries of consent were blurred by the normalcy of the pornographic script. The third pathway is through grooming. Pornography is shown to a victim to normalize and pressure them into sexual behaviors for which they may not readily consent. While we typically think of grooming as an adult preparing a child for sexual assault, it can also include children and teenagers using pornography to train and prepare other children for sexual assault. This was frequently mentioned in assaults on or committed by teens. Teenagers, particularly boys, would use pornography to pressure others into sex or sexual behaviors for which the victim did not readily consent. The fourth pathway is through overt power and threats. Pornography is used to threaten a victim as a means of gaining power and exerting control. Children's accounts of sexual assault frequently mentioned that they were threatened with exposure of the documentation of their abuse to parents, peers, or the public as a means of preventing them from reporting the assault. Revenge porn is another example of this type of mediator. And the risk of child sexual abuse can travel through any and all of these pathways. It wasn't uncommon to find that pornography was utilized in sexual assaults in multiple ways. And what we saw was that pornography was complicit in some way in child sexual assault across all type of age groups and all forms of child sexual assault, no matter the age of the perpetrator. And finally, we see that the sexual assault of children can sometimes lead to the production and consumption of pornography. So therefore, closing the loop and creating the cycle. The clearest example of this part of the cycle is the documentation and distribution of the actual assault as a means of producing child pornography. Additionally, respondents reported that victims would often turn to pornography as an ineffective means of coping with their assault and processing their experiences, which then, of course, puts them back into the cycle at the top and makes them vulnerable to the continuation of the mediators, right? The pathways. However, all is not lost. On the bright side, frontline professionals indicated that there are effective means for reducing risk among children. First and foremost is that we must begin to challenge the underlying assumptions of objectification and dehumanization that are present in mainstream pornographic content by strengthening empathy, mutual respect, and egalitarian gender beliefs. Given the massive scope and presence of pornography in the lives of children and adolescents, this counter-narrative must come from a variety of sources and be readily available to parents, educators, healthcare workers, and the community at large. Second is that we must build literacy around the topics of sex, sexuality, and sexual health, including the realities of pornography and the pornographic script. And we must approach these discussions with openness and acceptance and inclusiveness rather than shame, guilt, blame, or marginalization when addressing these topics. All children must have a safe space to ask questions, reveal experiences, and find support for healthy and inclusive sexual development. Third, we must improve our sexual education curriculum in the schools. I know you all are not surprised by that, but it can't be emphasized enough. Sex education that is inclusive, comprehensive, accurate, and challenges the pornographic script is essential to reducing risk and improving sexual health and development among children. This literacy and educational approach should extend to healthcare and other frontline professionals. And finally, we must provide social, technological, and community support to parents and families in order to help them effectively address the challenges of parenting in the face of rapid technological change. Access to affordable healthcare and comprehensive social services is key. In conclusion, this research not only provided empirical support for the connection between child sexual abuse and pornography, but it also highlighted the importance of the topic and the necessity of further research. Participants frequently described noticing a marked increase in child and child sexual assault, challenging notions of child abuse as being perpetrated solely by adults. Many stressed the importance of preventative efforts, with comprehensive and inclusive sex education most commonly cited. And finally, we hope that this model proves useful to healthcare providers, families, schools, frontline professionals in educating parents and communities on the role that pornography can play in the production and reproduction of sexual abuse. And I have references here.